Well, Nick Garnett is outside Jimmy Savile's former home in Leeds. Nick, a lot of reports that have come out today into Savile, including City, and the kind of abuse that went on there where you are in Leeds.
Yeah, this is the building where Savile lived. A weird building, even years after he left it. A lot of work has been done on it now, but it sits in Rounds, north of the city centre. I remember one Sunday night 10 years ago, I interviewed him here. As I said, we're north of the city centre. After the interview, he asked me to ask him why he wanted to go at that time of the night. It was pitch black. And he said that it was dark. He liked going there when it was dark. He knew everyone there, and he told me he had a lot of respect there. Well, today, on top of the report at Stoke Mandeville, 16 other hospitals and NHS trusts have released the findings of the work they've been doing to trace Savile's movements in their buildings. At Leeds General Infirmary, where he worked as a volunteer porter, 6 more victims and 2 witnesses have come forward. At Rampton Secure Hospital, Savile carried out 4 incidents of what's termed sexually inappropriate behaviour. The hospital heard how he used to drive a motorhome around the grounds, beeping his horn in a particular way to attract children living nearby to run behind it. Now, in the other hospitals issuing reports today, in many of them, there wasn't enough evidence to point to Savile actually abusing patients, although it was suggested in many cases that that's what had happened, but there just wasn't the paperwork to do it. Some said that what was interesting was that so many hospitals, out of all this 16 long list, had such a hard time tracking down the activities of, frankly, one of the most famous men in Britain at that time. Paperwork detailing his visits had been destroyed, records of visits weren't kept, and today there are calls for VIPs and famous people to be much more closely monitored if they're in a hospital, and for staff to put much greater emphasis on patient safety than they may have done before. The message is clear, though, that the lessons of Savile have to be learned.
Yeah, thanks for that, Nick. That's Nick Garnett, who's outside Jimmy Savile's former home in Leeds, just talking about the scale and the detail of the abuse. Dr. Bernard Gallagher is with us as well, a child protection expert at the University of Huddersfield. Bernard, what's your initial reaction to what you've heard today? And as we're saying, the detail, not only the way that he went about his business, his horrible, awful business, but the scale of it as well.
Sure. Good afternoon, Dan. In some ways, I would have thought I couldn't be any more shocked because, we've had previous reports about the activities of Jimmy Savile elsewhere. But again, hearing about the reports today, I'm just shocked again, both about the extent and the, in a sense, depth of his depravity, really, but also the power he was given basically within the NHS.
And there are recommendations today about checks being made on volunteers and celebrities going into hospitals. Do you think that is that the right step to be taken? Because part of the annoyance, I suppose, when people are listening to this story and when we're covering it as well, is that people aren't being held to account.
I think it is important to have these checks in place, but those sort of measures can only be part of a wide package of things that we need to do. I think what we also need to do is change the culture, because it's quite clear from all these reports that an awful lot of people knew what Jimmy Savile was doing, but there was a sort of acceptance or a reluctance to challenge it, as if, well, maybe, basically sexual offences weren't that serious. So we've got to change the culture. Everyone in society has got to recognise and accept that sexual offences are deadly serious. Other than that, touching upon your point about people being held to account, I think where there has been fault on the part of professionals, then they have to be held to account. And I think one of the concerns here maybe is that maybe people are trying to deflect criticism or minimise criticism from senior managers.
Yeah, I think that's what many people are thinking. Bernard, thanks for your time on 5 Live. That's Dr. Bernard Gallagher, who's a child protection expert at the University of Huddersfield.
The University of Huddersfield, inspiring tomorrow's professionals.